the pandemic COVID effect on Mobile County and our residents and community. Before I get started with the numbers, because this is going to disappear from this phone quickly, we have implemented our drive-through rabies clinics. So Saturday rabies clinics are planned in May for dogs, cats, and ferrets. The health department provides low-cost rabies shots for dogs, cats, and ferrets that are good for 1 year during weekend clinics. And here's the list of rabies clinics planned for Saturday during May in Mobile County. On May 23rd from 1:30 to 3:30 p.m. at Cuddle and Kisses on 11,120 Meadow Lark Road. That's 11120 Meadow Lark Road in Grand Bay. And on May 30th between 1:30 and 3:30 at St. Elmo Feed and Seed at 9001 Highway 90 West. So we'll be, making sure that you're adhering to social distancing practices. So both of these will be drive-through clinics. The cost of the rabies vaccine for your pet is $12, and all the shots are payable in cash. So good information as we start to enter the summer season. We usually see the number of animal bites go up. So make sure that you have your pet protected against rabies. All right, back to COVID-19. Worldwide, 4.2 million cases reported internationally with 286,000 deaths. In the United States, almost 1.3 million COVID-19 cases with over 80,000 confirmed deaths. In Alabama, we've crossed the threshold of 10,000 cases. This morning, there were 10,167 confirmed cases reported in Alabama and 423 COVID deaths. And in Mobile County, we have 1,489 cases of COVID-19 disease with 188 or 12.5% hospitalized and 93 or around 6.2% who've died from COVID illness. Again, it's very striking to see that we have deaths almost every day from COVID-19 disease in our community. So this is still a very clear and present threat, and we want you to continue to protect yourself and your community members, your families, your churches, your social groups. We're still seeing the largest number of cases, the largest proportion of cases between the 25 and 64 age group. We believe that this is where the most community transmission is taking place. And then for persons age 65 and over, they represent just over 26% of all of our cases. 60% female, 40% male, 44.7% African American, 0.4% Asian, and 28.1% white. And then we have every zip code now with cases of COVID-19 in the county. Among our diagnosed cases, 15% of them are healthcare workers, around 8% are employees of long-term care facilities where we have outbreaks, and 15% or so are residents of long-term care facilities. And we're still sitting at about 19% who did not have symptoms at the time of their first interview or after we contacted them back. So that's good information that people are recovering from illness. Among the hospitalized, they are mostly 65 and over. 90% of them are 50 and over, 53% female, 59% African American, 35% white. And again, a large number of them are on mechanical ventilation or require intensive care. Among the 93 that have died, 77% of them are 65 and older, with about an even split between male female, also almost even between African American, white, and other races. And 92.5% of them had underlying conditions that we know about, and around 50% of them were former long-term care facility residents, and a few of them long-term care employees. Let's see, I believe that's, I just want to mention we are starting to see a little bit of a Monday through Friday pattern with our reporting, that some labs are either not testing as much or not reporting as much on the weekends. And so we generally see a smaller number of cases when in the following the weekend, and then it kind of pops up for a few days later in the week. But if we look at things over a 14-day average, we're adding about 38 to 40 new cases on any given day. We know from some of the work that we've done to look at laboratory testing. I think when I looked this morning, we had over 14,000 laboratory tests that had been reported for Mobile County residents, and the largest number of those are negative, of course, because we have about 10% are positive, so 90% of them are negative. So it goes to show that every week we have built more and more capacity for testing, so we're not in a testing shortage. There are plenty of locations out there that you can get a test if you feel like you need one. Again, at most Mobile County Health Department locations through the Family Health Primary Care Division, you can get a COVID test. Just call our appointment line to get that reservation. All right, a couple of questions. We had one yesterday. Someone else is still asking about the reproductive rate, or the R-naught for the virus in Mobile County. It takes quite a bit of work to do the contact tracing that is necessary to calculate the R rate. We have begun contacting our contacts, and that work is ongoing, but our efforts to date have been to focus on interviewing our cases, and that's where most of our energy has gone. It probably will be some time before we could potentially even contact the R-naught value for coronavirus in Mobile County. It's affected by a lot of things. So, if it's happening with these large outbreaks, we know that we have a lot of contacts being exposed through congregate settings, so that sometimes can skew the data a little bit, but we'll continue trying to contact the contacts. The first 400 or so that we've been able to reach, about 30% of them were already laboratory confirmed with COVID disease or already had symptoms of COVID. So it's really important that if you are if you're a household contact, a close contact, an intimate partner, or if you've been within someone within 6 feet for 15 minutes or longer who has laboratory confirmed COVID, it's very important that you adhere to the stay-at-home order and instructions that public health provides you, because again, the first 400 or so that we contacted, around 30% of them were already laboratory confirmed. So it's a highly infectious virus, and we want you to continue taking the instructions from public health seriously. Some questions about what's the advantage for restaurants offering outdoor dining. I think, we've had some beautiful weather over the last couple of weeks, and everyone has been adhering to the stay-at-home order, and we're itching to get out and enjoy some sunshine. So for me, that is the greatest advantage, is sitting outside in the nice weather before we get too much into bug season. But again, restaurants or dining facilities that want to offer outdoor seating, you need to check with your local codes. Not every location is able to just put a picnic table outside, and if you do have outdoor seating, it has to comply with those recommendations that were put forth through the Safer at Home order to support social distancing and easy sanitation and those sorts of things. More questions about nightclubs, and we got a little bit more guidance on nightclubs. I didn't bring it with me, but the ABC board and I think some of the ADPH, the state environmental health agencies, have gone a little bit further to describe that it's not just a bar with a dance floor that is considered a nightclub. The intent, the spirit of the order was to not allow social gatherings around common pool tables or foosball tables or cornhole or whatever other sort of things are in bars that would cause people to be within 6 feet of one another for extended periods of time. So I think the nightclub designation was sort of an easy one, and it's gotten a lot of attention. But again, it has to be a place where just socializing and drinking and staying open late is discouraged and not allowed in the Safer at Home order. So again, any type of social activity inside a club and bar that would limit or prohibit or make it difficult to implement that 6 feet. Is this it, Mark? All right. So to further clarify the nightclub versus bar, any activities that cause people to congregate in a close proximity, dancing, pool, darts, foosball, shuffleboard, cornhole, full contact Jenga, axe throwing, tiddlywinks, etc., are not allowed currently under the amended order and may not take place. I did not write that. That came from the state. So try, read the order, don't socialize, and break the order. Again, because it was, issued as an emergency rule, you could be charged with a misdemeanor if you violate the Safer at Home order. All right, somebody asking me about a statement that Dr. Fauci of the National Institutes of Health made today. Let's see, he supposedly said there's a real risk that you will trigger an outbreak that you may not be able to control. I think the context of this was reopening. And yes, we are concerned about reopening too soon or too late. It's never easy. These are not black and white decisions, so we have to balance health with economics, with mental health, and we're doing our best to monitor closely to determine what the unintended consequences are of relaxing the public health stay-at-home or Safer at Home order by keeping an eye on the number of cases that we see ongoing about our community. If people will wear their cloth face coverings and social distance and wash their hands and cover their cough and stay at home when they're sick, then we should be okay. But there's a real risk to the attitude that seems to be out there that, this isn't going to hurt me. I'm not going to get sick. Why should I have to do, play my part with keeping the community sick? I don't want to wear a mask. And those types of behaviors are risky for all of us because there is so much asymptomatic transmission that is going on around the community. Someone also commented about the fact that people in gyms or athletic facilities seem to not want to adhere to the social distancing guidelines. So there is an entire guidance document around the context of the Safer at Home order, and athletic facilities are responsible for implementing this. The health department does not have regulatory authority. We're not going to go out and check to see that you're following the rules. It's law enforcement that can charge you with a misdemeanor if you're not following the Safer at Home order. But there are a lot of guidance for athletic facilities and gyms about best practices, minimum practices, mitigating exposure, limiting workout lengths, a whole host of things that those business owners should be doing to try to protect their patrons and their employees from transmission in a facility. That becomes a congregate setting when you have a lot of people inside a gym or a lot of people inside a religious temple that are, there next to each other for an extended period of time. And we will start to see outbreaks associated with these gatherings. I guarantee you. So try to follow the public health order and encourage your family members and your peer groups and your employees and your employers to do the same. It's going to take all of us sort of creating this new social norm that a mask, everyone should be wearing a face covering when they're out. Let's see. Why are face coverings not mandated? Why should face coverings be a personal choice? So we hear both sides of this coin. Lots of you think that it should be a mandate, that we're not doing enough to require people to wear face coverings. And then as soon as I say they're strongly recommended, we get complaints on the other side of people saying that we're denying their civil liberty and they are not obliged to follow a public health order. So somewhere in there, there is a personal choice to stay healthy and protect others or not. And so that choice is up to you, and we hope that you will make a good one, not just for the protection of yourself, but also for the health of your immediate family and close relatives that you might be interacting with who themselves are trying to stay healthy, but maybe have some of those underlying conditions that are going to cause them to have severe complications if they get infected from you. So I think that is all for today. I just wanted to maybe read one more thing from the CDC guidelines. We're starting to get questions about, now that we're opening back up, or the safer at home order has been modified somewhat, can we travel again? And I just want to remind you that CDC and the State Health Department and Mobile County Health Department is still recommending that all persons defer any travel on cruise ships, including river cruises, worldwide because of the increased risk of COVID-19 on board ships. This same thing, there's not a prohibition on flight travel, but you will begin to see, as we're booking flights now into late summer and fall, you will begin to see some airlines require cloth face coverings in order for there to be domestic travel or international travel. So again, try to avoid non-essential travel. We're still recommending against booking cruise travel, and that not for me, again, directly from the Centers for Disease Control. So I think with that, I will end for today unless there are any other questions. Okay. So remember, now that we are operating under unified command with the City of Mobile and the County Commission's office, they have scheduled joint press conferences on Wednesday. So we will not hold a Facebook Live update tomorrow. We'll pick back up again with you on Thursday. Have a good evening, everybody, and stay safe.